Hi, I'm Dr. Albert Reff. We've put together this instructional video to assist in your rehabilitation after your total hip surgery. But it's not intended to replace professional instruction from a licensed physical therapist. All of us wish you a rapid and safe recovery, and thank you for watching.
Hi, my name's Diane Blagievich. I'm a physical therapist. I've been working in the South Bay for over 10 years doing physical therapy. I've had the pleasure of working with Dr. Reff with his total hip and knee patients at home, doing home health over the last several years. We've put together this exercise video to help you with your home exercise program after hip replacement. To begin with, there are 3 exercise principles to remember. Number 1, you need to be your own physical therapist. Remember that after you've been shown the exercises, to continue doing your exercises at home. Number 2, you need to do your exercises frequently, 4 to 6 times a day, but for short periods, about 15 minutes. If you over-exercise, you may become sore and it can be counterproductive to your recovery. Number 3, your exercises should not be painful, or the pain should not last for more than 1 minute after exercise. Be aware there's a difference between mild stretching discomfort while you're gaining flexibility. This is good pain. If the pain is long-lasting, this is bad pain. If you're experiencing lasting pain, you may try doing some brief exercise or try an ice pack, 10 to 15 minutes, 2 to 3 times a day, remembering to put a towel between your skin and the ice pack. Or you may check to correct or modify your exercise position for comfort. If the pain continues to be unusual or long-lasting, please have your physical therapist, nurse, or doctor assess your hip for any problem. Hi, I have Karen with me. She's a patient of Dr. Reff's, and she had hip replacement surgery on her left side, and she's going to help me demonstrate the home exercise program. First, there are 2 precautions you need to always follow. This helps to reduce your risk of dislocation. Number 1, you always want to roll or move toward your surgery side, as Karen's lying down on her surgery side, getting into bed. You can roll toward your surgery side on her left. You always want to keep the bed flat when you're exercising or rolling, and then come back. Always rolling back toward your surgery side and getting out of bed on your surgery side. Again, this keeps the stress off of your hip and reduces your risk of dislocation. Number 2, to prevent a permanently rolled out leg, always use a towel underneath your hip. This will align your leg and prevent it from turning out for long periods of time. Now we'll begin Dr. Reff's total hip replacement exercise program. You'll start lying on your back. Number 1 is ankle pumps. You'll place a small towel underneath your ankle and begin to pump your feet up and down. This will stretch your calf and your ankle. You can do up to 10 repetitions. Number 2 is quad sets. You'll keep your knee in a neutral position, which means your toe and your kneecap are pointing up to the ceiling. You'll flex your foot up, keep your towel roll underneath the ankle, and here you'll push your knee down into the bed to straighten and tighten your quadricep muscles. Hold for a count of 5 and then relax. Flex the foot up, push the knee down into the bed, hold for a count of 5 and relax. Number 3 is the hula exercise. You'll begin with your legs straight, especially at the knees. You're going to push one leg longer than the other with the movement coming from the hip. You'll feel the hip go up and down as one leg goes longer than the other, and you can do this for 10 repetitions. Next is exercise number 4. This will be internal and external rotation. With this exercise, we'll begin with the feet apart, and you'll roll the legs in and out. First you'll roll in to touch the big toes together, and then out. Roll in and out. And do this exercise for 10 repetitions. Exercise number 5 is the Thomas stretch. With this exercise, you'll begin with your legs on the bed. You're going to bring your unoperated leg up to bring your knee toward your chest. Keep your operated leg down on the table so you can feel a stretch in the front of your hip. Bring the leg back down and you'll repeat. Bring the unoperated leg up toward your chest. Keep the operated leg down on the table, especially keeping the knee straight so you can feel a stretch at the front of your surgery hip. Come down. And you can repeat this 10 times. Our next series of exercises will be on your stomach. Remember to roll over your operated hip. And our first exercise will be knee flexion. We'll begin one leg at a time, bending at the knee, and then the other leg. Remember to keep the hips flat on the table. And when you bend your knee, you're going to feel a stretch at the front of your thigh. You can repeat this exercise 10 times. Good. Exercise number 2 is internal and external rotation. We like to call it windshield wipers. With both of your legs, you'll bend your knees and then cross at the ankles to cross your legs, and then uncross, making sure the feet come apart to stretch the hip. Cross and uncross. You should feel a stretch deep in your hip. Good. And uncross. You can repeat this exercise 10 times also. Exercise number 3 is prone hip extension. You'll start with your leg flat on the table and flex your foot so your toes are resting up on the table. You're going to straighten your knee to lift it off the table. You want to feel a stretch in the front of your thigh, and also you want to keep your hip down on the table. Don't let that come up. Hold your knee up for a count of 5 and then relax. Good, and relax. And lift. Again, make sure you're keeping your hips flat on the table so you can feel a stretch in the front of the thigh. Our next series of exercises will be in the sitting position. Our first exercise is hip flexion. This exercise consists of 2 different parts. Our first one will be the extension, or straightening your body. You want to begin with your knees back at the edge of the bed. You can have your operated leg off the floor and your unoperated leg on the floor for balance. You're going to push your knee down into the bed, bring your hands behind you, and lift your hips up off the bed. And then come back down. We'll do it again. Push the knee down into the bed, lift your hips up off the bed to straighten your body, and back down. The second part of the exercise is hip flexion. Here, you're going to bring your feet underneath you on the bed. You're going to bend at the crease in your hips. You don't want to bend at the waist, as this only stretches your back and not your hips. Bend at the crease. You'll come forward as far as you can tolerate. Come up and stretch your feet back out. Again, bring your feet underneath you. Bend forward at the crease in your hips as far as you can tolerate. Come up and stretch your feet back out. As you become more proficient with the exercise, you can combine both part 1 and part 2. Here, you're going to have your hands behind you. At this point, you may be able to bring both feet off the floor, and you're going to lift your push your knees down into the bed and lift your hips. Come up. Bring your feet underneath you, bend forward at the crease in your hips, and come up. Bring your hands behind you. Your feet come off the table, push your knees into the table, lift your hips, feel a straight body, come up. You're going to bring your feet underneath you, bend forward at the crease in your hips, come up, and stretch your feet out. You can do this exercise for 10 repetitions. Exercise number 2 in a seated position is internal and external rotation. Here, we'll begin with our feet together, and you can let your knees go apart and then back together. You should feel a stretch in your hip and let them go as far apart as comfortable. The second part of the exercise is to bring your feet apart and then let your knees roll together so they touch. You want to feel a stretch along the hip on the outside. And again, it should be as comfortable as you can tolerate, but still feel a good stretch at the hip. Exercise number 3 in a sitting position is to reach down toward your foot. You'll do this on the operated leg only, and you'll take one hand and reach down the leg as far as you can comfortably feel a stretch at your hip, and then you can use the other hand on your operated leg to stretch down and come up. Remember, it's important with this exercise to bend at your hip where your pants wrinkle here, not at your waist. Fold over so your body's folding on top of the thigh. Good. Our next set of exercises will be in the standing position. You're going to always do these exercises in front of a bed or chair, so if you lose your balance, you can sit back down. You're going to stand up, and we'll begin with the first exercise, which is marching. You're going to lift your leg up as high as you can and back down. This is your operated leg. You're lifting up and down. I'm going to have Karen demonstrate. Good. As you feel steady and more secure with this exercise, you're going to progress to alternate your marching. You want to keep your pressure on the walker with your hands, and you're going to lift the leg up and then your other leg up. Good. When you're standing on your operated leg, again, keep the pressure on your hands so not all your weight goes through the operated leg. Remember your partial weight bearing. Our next exercise in standing is hip extension. Here, you're going to push the hips forward, come up on the toes, and look up toward the ceiling so your full body is extended. Make sure that you're feeling the stretch at the front of the hip when you're extending. You should feel it in the front, along the front of the thigh. And depending on your balance, you may or may not come up on your toes, but we want to try to. Good. Next, we'll start the stationary bike. Here, we're going to begin with the seat height as high as possible, but that you can still reach the pedals with your feet. I want you to make sure for your safety that the bike is secure and the seat is not going to move. Also, make sure your handlebars are secure and not moving. When you approach the bike, you'll do that from your unoperated side. The leg that will go over the bike will be the one that did not have surgery. You can approach the bike by using your arms and keeping your weight on your arms so you can maintain your partial weight-bearing status on your surgery leg. Come up on the bike, feet on the pedals, and you can begin. Here, Karen's going to help me demonstrate the stationary bike. Notice I have the height of the seat adjusted so that the leg can be fully extended when the pedals are down. Also, I don't have the straps on her feet, so if needed, your feet can come off the pedals. Karen's doing a half a rotation. In the beginning, this is a little easier because your hip may not be as flexible. As you increase in flexibility, though, we'll start to do a full rotation. Go around forward. Good. And you'll start to feel more of a stretch at the hip. As you're rotating around all the way, you do not need any tension on your bike. Remember, this exercise is for flexibility and not for strength. You can also slow down the pedal and reverse and go backwards with the pedal. This just works your muscles a little differently. Good. There will also be 3 positions to work on also with the bike. The first one is to let your knees go together as you're pedaling around. This gives a different stretch to the muscles in the hip. Then you're going to next bring the knees apart. You do this as much as comfortable. Good. Our third position is leaning forward. Just as we've done with the previous exercises, bend forward at the hip and not the waist. Good. It's almost like a position when a jockey rides a horse. Good. Here we're going to start with the front wheel walker for transfers and walking. First, coming up from a bed or a chair, you're going to scoot forward to the edge. You're going to use your hands on the bed or the chair to push up from, and you're going to bring your operated leg forward to keep the weight off of it. Lean forward and push up from the chair. Hold on to the walker. Remember to keep your body straight and tall, as this helps to retrain and strengthen your muscles properly. You're going to start the sequence with the walker by moving the walker forward, taking a step with your operated leg, and then your unoperated leg. Walker, operated leg, unoperated leg. Our goal is to get one foot ahead of the other so your step lengths can be equal. Here, we're going to do some crutch training. As we begin, you've transitioned from the walker as you've become more confident and improved with your balance. And we're going to start with crutches, doing a transfer from a bed or a chair. You'll start by holding both crutches in one hand, and the other hand will be on the bed or chair. You're going to have your operated leg forward and your unoperated leg back. Scoot forward in the chair, and then go ahead and push up with your hands. You can bring the crutches around once you're standing. Place them underneath the arms. Make sure you're standing up tall and you're not leaning on the crutches, as you have delicate nerve tissue that you can damage if you lean on the crutches too much. Stand up tall. The sequence here with the crutches is to bring the crutches forward first, step with your operated leg, and then your unoperated leg. Crutches, operated leg, and unoperated leg. Crutches, operated leg, and unoperated leg. As you become more confident with your ability and your balance, you may bring your crutches with your operated leg and then unoperated leg. Crutches with the operated leg and unoperated leg. As your recovery continues, you'll transition to a cane. Here, you will do the transfer out of a bed or a chair. You'll push with your hands up to an upright position and grab your cane. The sequence with the cane is to always have the cane in the opposite hand from your surgery leg. You're going to bring the cane forward, step with your operated leg and unoperated leg. Cane with the operated leg and unoperated leg. Remember to stand up tall as you're retraining these muscles for balance. A walker may be used going up and down stairs. However, we recommend that you have training by a licensed physical therapist first for your safety. We'll use crutches going up and down the stairs. Always remember the golden rule. You'll go up with your good leg or your unoperated leg, so the stronger leg can bring you up the stairs, and then follow with your operated leg. Here we'll demonstrate. Up with your stronger leg, and then the crutches. Up with the unoperated leg and crutches. Up with the unoperated leg and crutches. Let the unoperated leg be the one to bring you up, followed by the crutches and the operated leg. Coming down with the stairs with the crutches, your sequence is to bring the crutches first, then your operated leg, and then your unoperated leg. Crutches, operated leg, and let the unoperated leg be the strong one to bring you down. Crutches, operated leg, and unoperated leg. Crutches, operated leg, and unoperated leg. Crutches, operated leg, unoperated leg. Good.